Hi Farmies. I already posted another video on insulin that really covers like in depth because it's such a big topic. But I did want to kind of do a little mini video to kind of give you the real world of how we handle insulin in the hospital. So these are the cards that come with the insulin topic. So rapid acting, peaks. Really, the peaks are what you need to really focus on because your patient needs food during that peak time. So the onset and the peak of determine when you give the food and when you make sure your patient has food. And all of that is going to be ordered by the doctor. So you give the medication that is ordered. It's not like you have to pick, am I going to give rapid acting or regular or NPH? That is ordered by the physician. So you just need to know when the onset and the peak and the duration are for the main types of insulin. Key thing to remember with the long-acting insulins, the glargine, otherwise known as Lantus, the long-acting ones, the onset is an hour, but there is no peak. It lasts for 24 hours. All right, so that's what we call the basal dose of insulin. So I want to go on and just kind of give you a little overview to answer a couple of questions. So we do a basal dose of insulin, a long-acting insulin, once a day, sometimes twice, usually once, no peak. All right, there's no peak for that basal long-acting insulin. Then we give nutritional insulin. So this is medication that is a mealtime dose. It's calculated based on the number of carbohydrates that the meal will contain, and your patient will have an ordered ratio. So say your patient's ratio is one the total grams of carbohydrate divided by their carb ratio. So 15, 15 carbs per 1 unit of insulin, and they have 45 carbs in their meal. You divide that by the 15, and then you get 3 units of insulin would be given to cover that carbohydrate intake. So that's their nutritional insulin. The next thing that we would have is what we would call a correctional dose. That's the more modern term. It might also be called, you might hear nurses call it a sliding scale. That's a little bit older term. But correctional dose is more descriptive because what you're doing is you're correcting their current blood sugar level. So if you check the patient's blood sugar, and according to this one, we'll say their blood sugar is 260. All right, I check their blood sugar, it's 260. So I look at their sliding scale, and this will be in their chart. You will know based on their order which sliding scale chart to look at. And they might be a level 1, a level 2, or a level 3 based on their sensitivity to insulin. So most patients would be at this level. So we would say their blood sugar is 260, so they're going to need 6 units to correct their current elevated blood sugar. Then they would also need, based on their meal, they're going to need 3 units. So we're going to give them a total of 9 units of insulin for that meal. Because if we only give this and we don't do carb coverage, then we're going to fix their blood sugar level, but then they eat a bunch more carbs, so then they're going to swing the other direction again. So what we really need to do, it needs to be this comprehensive insulin management plan. So we'll say, well, here's my example. Patient's blood glucose is 260 at, we'll say, 7 a.m. So I'm going to decide, I'm the nurse, I came on at 7 o'clock, their breakfast tray is going to get there at 7:30, and I need to treat their blood sugar based on what their breakfast tray is going to be. All right, so what I could do is I could correct this blood sugar now. So I could give 6 units if I wanted to, if I have time. I could give 6 units now. And that's going to fix their blood sugar of 260. Then their breakfast tray gets here, and the tray has a total of 45 carbs on the tray. And I'm going to divide that by my patient's ratio, which This patient has a ratio of 15, so they're going to get 3 units based on their carbohydrates. So now that their tray is there, now I can give them their 3 units. Because they see everything on the tray, they're going to eat it, everything looks good, they're ready to go. They can have those 3 units. So it depends on what you're fixing. So everyone's worried about when to give the medication. So it's going to depend on what's ordered, whether it's regular or Lispro, and it's going to depend on what you are fixing. So if I haven't gotten to see my patient yet, his tray just got there, I know what his morning blood sugar was, and I'm going to give it all at once, then I could give the 9 units right now. So if the tray is there, I haven't seen him yet, his morning blood sugar, so the tray is worth 3 units. His morning blood sugar is worth 6 units. So now that his tray is there and he's about to eat, I'm going to give him the 9 units. All right, so that's kind of how it works in the real world. There's always those two things. There's the nutritional component, and then there's the correctional insulin, which I'm correcting correcting an elevated blood glucose to go along with his meal. All right, I hope that kind of helps clear up what you guys were talking about with insulin. And just watch the other video that I posted for the big tips and tricks. Here, I'll show you these cards one more time because I know you guys really like them. Remember if short-acting insulin looks cloudy or discolored, don't administer it. You have to remember which ones are supposed to be cloudy and which ones are supposed to be clear. And then remember that there is no peak with the long-acting. It's the basal dose. It's a nice baseline, a steady baseline. All right, guys. Have a great day.